Welcome to another deep dive, everyone. Today we're going to be looking at something pretty interesting in the world of veterinary neurology.
Yeah, this is a really cool new study.
Yeah, so we're talking about prednisone tapering in dogs after they've undergone radiation for a brain tumor.
Right.
And, prednisone is something that comes up all the time with our pets.
For sure.
It's a powerful medication, but it also has a whole bunch of potential side effects.
Yeah, it's kind of like a necessary evil, right? It's really effective at reducing swelling and inflammation in the brain, which is obviously crucial after, radiation therapy for a tumor, but the side effects can be pretty rough.
Yeah, like what are we talking about in terms of side effects?
Well, increased thirst and urination, definitely, like a crazy hunger weight gain, and even some GI issues.
So not fun for anyone, especially our furry friends.
Definitely not.
So traditionally, how have we managed this tapering process, after brain radiation?
Well, the standard approach for a long time has been this slow taper method, where you gradually reduce the prednisone dosage over several months.
Months.
Yeah, months.
Oh, wow.
Which, when you think about it, having to deal with those side effects for months on end, it's not ideal for anyone.
No, not at all. And I'm sure that can be really hard on the owners, too, seeing their dog go through that for so long.
Yeah, absolutely. It's tough all around.
So what's different about this new study?
Well, this study basically says, hey, maybe we don't need to drag this process out for months. Maybe we can do it much faster and still get good results.
Really?
Yeah. So they looked at this rapid taper protocol, and the results are actually pretty exciting.
Okay, before we get too far ahead, can you walk me through this study design a little bit?
Sure. So they had two groups of dogs. One group got this new rapid taper protocol, and the other group got the traditional slow taper approach.
Okay.
But it's important to note that the rapid taper protocol isn't one size fits all. They actually had 4 subgroups within that rapid taper group based on the dog's prior exposure to corticosteroids.
Okay, that makes sense because, a dog who's never had prednisone before might react differently than a dog who's been on it for a while.
Right, exactly.
So what were the main findings? Did this rapid taper actually work?
So it did. The dogs in the rapid taper group got down to their lowest prednisone dose in an average of 41 days compared to 117 days for the slow taper group.
Wow, that's a huge difference.
It is. And not only that, but a much higher percentage of the dogs in the rapid taper group were able to completely stop taking prednisone, 84%, versus only 50% in the slow taper group.
That's incredible. But I'm sure our listeners are wondering, is it safe, is it safe to reduce the prednisone that quickly?
Yeah, that's the burning question, and that's what the researchers were really focused on. They monitored the dogs very closely for any adverse effects, and the good news is the rates of complications were similar between the two groups.
So the rapid taper didn't seem to cause any additional problems.
Right, it seems to be just as safe.
That's great to hear. So we're talking faster tapering, and it seems to be just as safe as the traditional method.
Exactly.
But what about the dog's quality of life? Did reducing those prednisone side effects so quickly actually make a difference in how they felt?
That's a great question, and that's where things get a little bit more complicated.
Oh.
Yeah, so the researchers used a specific questionnaire called the CanBrain QOL to assess the dog's quality of life, and they looked at things like, energy levels, appetite, mobility, all sorts of factors.
So what did they find?
Well, the interesting thing is the scores didn't really change much over time for either group.
So no big improvement in quality of life, even though the rapid taper group got off the prednisone so much faster.
Yeah, that's right.
Interesting. So did that mean the rapid taper isn't worth it then?
Not necessarily. I think it's important to remember that quality of life is complex. There are so many factors involved, and it's possible that the dogs were experiencing improvements in certain areas that weren't captured by the overall score.
I see. So maybe they were a bit more energetic, or maybe they had a better appetite, but those changes weren't big enough to show up in the overall score.
Exactly. It's like looking at a big picture. Sometimes you have to zoom in and look at the individual details to really see what's going on.
That's a good point.
Yeah.
So overall, it seems like this rapid taper protocol is really promising. But you did mention earlier that there were some limitations to the study.
Right.
Can you tell me more about those?
Sure. So this was a pilot study, which means it was relatively small. Only 19 dogs were in the rapid taper group. And as we talked about before, not all of the dogs had their tumor diagnoses confirmed by biopsy, which could potentially affect the results.
Okay. And what about follow-up time?
Yeah, that's another important consideration. The researchers followed the dogs for 6 months after radiation, which is good, but some of the long-term effects of radiation can take longer to show up.
So we need more research with a larger group of dogs and a longer follow-up period to really confirm these findings.
Exactly. But even with those limitations, this is a really exciting study. It opens up a whole new way of thinking about prednisone tapering in dogs with brain tumors.
It does. So what's next? Where do we go from here?
Well, I think the big question now is, can we go even further?
What do you mean?
Well, if we can safely taper dogs off prednisone this quickly, could it be that some dogs might not need it at all?
Wow, that's a really interesting thought.
Yeah, it's definitely something to explore.
Okay, well, I'm excited to see what the future holds for this research.
Me too. It's an exciting time to be in veterinary neurology.
Well, that's all the time we have for today, but we'll be back soon to dive deeper into this topic and explore some of those exciting possibilities.
Sounds good.
Thanks for joining us.
Thanks for having me. So, okay, let's actually break down this rapid taper protocol. Like, how does it work in practice?
Yeah, because it's one thing to say rapid taper, but I'm sure our listeners are wondering, what does that actually look like?
Right. So as I mentioned before, they divide the dogs into these 4 groups based on their corticosteroid history, before they even start the radiation.
Okay, so are they basically saying like, hey, not all dogs are created equal?
Exactly.
Let's tailor this process a little bit.
Yeah, it's all about finding that sweet spot, between reducing the side effects, but also making sure we're not compromising the dog's neurological health.
Right, of course. So tell me more about these 4 groups, who falls into each one, and how does the rapid taper protocol actually work for each group?
All right, so group 1, these are the lucky dogs who've never had prednisone before they start radiation, and they're only getting a short course, like 5 or fewer radiation fractions.
Okay, hold on. Back up for a second. What are radiation fractions?
Oh, yeah, good point. So radiation fractions just refer to the individual doses of radiation that are given over time. Oh, okay, so it's like breaking up the total dose into smaller chunks.
Exactly.
Got it. So back to group 1, what happens with them?
So for these dogs, it's actually pretty simple. They get prednisone before each of their radiation sessions.
Right.
To kind of, head off any inflammation. But then once the radiation is done, they're done with the prednisone. No more tapering needed.
Wow, that is rapid.
Right.
Okay, so what about group 2? How are they different?
So group 2 is similar to group 1 in that these dogs also haven't had prednisone before, but they're getting a longer course of radiation, like 6 or more fractions.
Okay, so more radiation sessions. Does that change the tapering process?
A little bit. So the beginning is the same. They get prednisone before each radiation treatment. But then after the radiation is finished, they cut the dose in half for a week, and then assuming everything is looking good neurologically, they get prednisone every other day for just 3 doses, and then they're done.
Okay, still a much faster taper than the traditional method.
Oh, yeah, way faster.
Okay, so that's the dogs who haven't had prednisone before radiation.
What about the dogs who are already on prednisone when they start radiation? Does that make things more complicated?
It does a little bit. That's where groups 3 and 4 come in. So group 3, these are the dogs who've been on prednisone for a month or less before they start radiation.
Okay, so they're already familiar with prednisone and all its fun side effects.
Exactly. So these dogs, they actually stay on their prednisone throughout the radiation, but the goal is to get them down to a specific lower dose by the time radiation is finished. Then, once the radiation is done, they cut the dose in half, and if they're doing well neurologically, they'll get that lower dose every other day for 3 doses, and then that's it.
Okay, so even though they were already on prednisone, they still taper pretty quickly after the radiation is over.
Yeah.
All right, what about group 4? This is the group that's been on prednisone the longest, right?
That's right. Group 4 is for the dogs who've been on prednisone for more than a month before radiation starts. And it's similar to group 3. They continue the prednisone during radiation with the goal of getting down to a certain dose, but because they've been on it longer, the taper is a little more gradual.
Okay, I figured it might be.
So after radiation's finished, they cut the dose in half. Then a week later, they cut it in half again. And then if everything's stable, they get that really low dose every other day for 3 doses, and then poof, no more prednisone.
Wow. So even for the dogs who've been on prednisone the longest, it's still a much shorter timeline than the slow taper method.
Oh, yeah, for sure.
It's amazing how they've really personalized this approach.
Yeah, it's really cool. It kind of reflects, this movement in vet med towards more individualized care, really recognizing that every patient is different.
I love that.
Yeah.
So, you mentioned that some dogs in the study did end up needing to restart prednisone after the initial taper. Why was that? Was it because the rapid taper wasn't working for them?
That's a good question. And it's important to understand that restarting prednisone wasn't always a bad thing, Sometimes it was because their neurological symptoms came back or got worse, which could be a sign that the tumor was growing again, or maybe even a side effect of the radiation itself.
So it wasn't necessarily a failure of the rapid taper protocol. It was more about what was happening with the underlying condition.
Exactly.
Okay, that makes sense.
And in other cases, they needed prednisone, again, for totally unrelated issues like allergies or skin problems. Dogs are just like us. They can have all sorts of health things going on, and sometimes that means they need medication, even if they were able to successfully taper off it before.
That's a good reminder that, it's not always a straight line.
Nope.
Things can change, and we need to adjust the treatment plan accordingly.
Exactly. So speaking of adjustments, we've been talking about this CAN-BRAIN QOL questionnaire that the researchers use to assess the dog's quality of life.
Right.
What do you think about that?
Well, I'm curious. Did the rapid taper group actually show any significant improvement in their quality of life scores?
That's where things get a little interesting, because you would think, less prednisone, fewer side effects would equal a better quality of life. But the study actually found that the scores didn't really change much over time for either group.
So no big difference in how the dogs felt overall, regardless of the tapering approach.
Yeah, that's right. But, it's important to remember that this CAN-BRAIN QOL questionnaire is pretty comprehensive.
Yeah.
It looks at a lot of different factors.
Like what kind of factors?
Things like their energy levels, appetite, ability to interact with their family, even specific neurological signs.
So even though the overall score might not have changed, maybe there were some subtle improvements in certain areas that weren't reflected in that overall number.
Exactly. It's like, looking at a tapestry from a distance. It might look the same, but if you get up close, you can see all the individual threads and how they contribute to the overall picture.
I like that analogy. So it's not just about the big picture. It's about looking at all the little details, too.
Absolutely. Now, speaking of looking at the details, we talked earlier about some of the limitations of this study.
Right.
Like the small sample size and the lack of biopsy confirmation for all the dogs.
Right. Are there any other limitations we should be aware of?
Yeah, I think the other big one is the follow-up time. 6 months is good, but like we talked about before, some of the long-term effects of radiation might not show up until later.
So basically, we need more research with more dogs and a longer follow-up period to really see the long-term impact of this rapid taper approach.
Exactly. But even with those limitations, this is a really important study. It's a big step forward in how we think about prednisone and brain tumors in dogs.
It definitely is. So where do we go from here? What's next?
Well, I think that's what we're going to talk about in the last part of our deep dive.
Okay, sounds good. Okay, so we've talked about this study on rapid prednisone tapering in dogs after radiation for a brain tumor. We've looked at, the potential benefits, the safety, the quality of life aspects, even some of the limitations of the research.
Yeah.
So now I kind of want to step back and look at the bigger picture. Like, What are the key takeaways here? And, what does this all mean for the future of treating canine brain tumors?
Yeah, that's the million-dollar question, isn't it?
It is.
So I think, the most exciting takeaway for me is that we might not need to keep doing these super long prednisone tapers that we've been doing for years.
Right.
This rapid taper protocol shows us that we can potentially get the same results much faster. And that means less time on prednisone, less time dealing with those nasty side effects.
Which is huge for the dogs and the owners, right?
Absolutely. It's all about improving their quality of life throughout treatment, not just, at the end.
Exactly. And I think it speaks to this larger trend in vet med towards more personalized care, recognizing that cookie-cutter approaches don't always work.
Right. One size doesn't fit all.
Exactly. So this rapid taper protocol, it's like a framework. Vets can use it as a starting point and then adjust it based on the individual dog.
Yeah.
How they're responding to treatment, all that good stuff.
For sure. For
sure. I feel like what's happening in human medicine too, right, with this move towards personalized medicine.
Absolutely.
But even with all this progress, it's important to remember that this is just one study. There's still so much more to learn.
Oh, yeah, this is just the beginning.
So what are some of the big questions that this research brings up? What are the next steps in this journey towards, better treatments for dogs with brain tumors?
Well, I think the big one for me is, can we push this even further?
What do you mean?
Well, if we can safely taper dogs off prednisone this quickly, could some dogs maybe do well with no corticosteroids at all?
Wow. That's a really interesting thought.
Right. Like, what if we could avoid those side effects entirely?
Especially for dogs with, smaller tumors, maybe not as many neurological signs.
Exactly. It could be a game changer. Reduce the risk of complications, improve their quality of life, maybe even simplify the whole treatment process.
I mean, it sounds amazing.
Mm-hmm.
But I'm sure there are a lot of challenges and things to consider before we just, stop giving prednisone altogether.
Oh, definitely. We need to be really careful and do a lot more research to figure out, which dogs if any, could actually safely go without prednisone.
Right, because every dog is different.
Exactly.
Yeah.
We need to look at, the type of tumor, the size, the dog's overall health, how they're responding to treatment. There are so many factors to consider.
But the potential benefits are huge.
They are.
So it's definitely worth exploring.
Absolutely.
It's like we're opening up a whole new world of possibilities.
It is.
Which is exciting and a little bit scary all at the same time.
Yeah, for sure. But that's what science is all about, right? Always pushing the boundaries, always asking new questions.
And hopefully finding new answers that can help our furry friends.
Exactly.
Well, I think that's a great place to wrap things up.
Yeah, I think so.
This has been a fascinating deep dive into the world of rapid prednisone tapering in dogs after brain tumor radiation.
It really has.
And to all our listeners out there from Vet Neuro Jar, keep those minds-inspired hearts light and tails wagging.